Hello, everyone, and welcome to this Insight series into healthcare with me, Chris Fordham, for the Light Review. This podcast was recorded about a month ago. Dan Lister of Arup is one of the country's leading lighting designers and recipient of 40 Under 40. I don't know about you, but when I'm working on healthcare projects, I'm always looking for the best examples because it's not something you can really take a punt at. This podcast is great for the snippets of information that you wouldn't otherwise be able to get in a short format. So hopefully you will find it as useful as I did. So Dan, when looking at the healthcare arena, for those designers just starting out, or even some of those who are perhaps a bit longer in the tooth, where was your starting point and what's your general approach to lighting in the healthcare arena?
Oh, interesting question. I think we need to start and think about who we're lighting for, as with anything. And I think understanding what the users are going to be and what's important for them is always a great place to start. So I guess there's multiple ways to approach that. You need to think about who those are, and so it's not just about the patients, but obviously they're an important part of anything that happens and anything that happens in there, and how they feel and experience an environment, but also about the staff and understanding how they their needs and their requirements. I think it's a really complex problem, the healthcare environment and healthcare setting. And it's really difficult to walk that line between a highly regulated and very defined set of parameters that's particularly within the NHS, shall we say, and a set of expectations, but then working out how to deliver something more that meets the needs and goes beyond merely compliance. And so, as with anything, I guess you need to start with daylight. And if you can start with daylight, then you can start to work out how we can provide better solutions and better environments and lower carbon environments in all that. Really difficult question, that, actually, Chris. I think it come in multiple strands, can't it?
Yeah. No, I mean, certainly, I mean, the thing that I think about with healthcare is that there are so many people in different positions, in different aspects of their health journey, if you like. So it's probably such a broad spectrum of society as well, all ages. And also, as you mentioned, it's not just the patients, it's the people working there as well. So it must be very difficult to find that balance, isn't it? Because everyone's needs are so different, I guess.
It just and the danger is it becomes a one-size-fits-all solution. And that's certainly something that needs to be considered. And the one size is often there for cost and maintenance and management, but it's also there for a good clinical reasons. Doctors need to have a constant and known amount of light, so when they're moving from space to space, they can make the correct diagnosis and understanding and comparisons. But actually, I think we need to think beyond that and actually providing greater, I'll call it resolution or definition of spaces and the needs and the requirements and what actually needs to happen in different areas is a really key part of what it's all about. So, as with anything, it's about understanding. And I think if you can truly understand what's happening, where and when, and how you can make the best use of what you're doing, it's a much better approach to delivering lighting designs. So, how many times do you go into a hospital or a healthcare setting and you see a standard recessed solution that runs everywhere, and then someone's gone, oh, what I need is a bit of a feature here, and so they've then added a feature on top of it, and so you end up with two lights rather than one light, or you ended up with it ends up brighter. There's never any less. There's always more. And I think sometimes it takes a step back and a strong opinion and a strong will and tactful negotiation to say, well, actually, we could not do this here and we could do that instead. And does this really need to be like that in this location, or could we think of it this way?
I think actually what you say there is a very undervalued skill set that lighting designers have, because of the nature of our business, we deal with all sorts of people, from contractors to architects, and we do have to be very persuasive, but not necessarily in a way which is aggressive, because it just wouldn't work, would it? I mean, how you mentioned the guides, or the fact that you do have a lot of principles and things. How often do you use the LG2 for healthcare from the SLL, for example? And I mean, I guess in practical environments, you do need a base level for things such as operations and such like. But in tandem with that, the architecture obviously has a massive part to play, isn't it? So how much would you say the building influences the daylight component, and how, as a designer, do you work within that framework?
Yeah, I guess and I laugh and I chuckle there, because actually I think LG2 is great, and I'm a great believer of it, actually, because it's not too prescriptive. It is an official document that's recognised in the NHS, but it also starts with daylight needs to be considered first. So it opens the door up into these conversations, even though balancing natural light and provision of natural light and all the other competing factors that fall into that can become quite difficult. But I'll call it the new LG2, but it's not. It's probably 2-3 years old now, isn't it? 2019. It's an important part of starting those conversations, and it means that if you can get there soon enough, and that's the big challenge. As a daylight designer or someone working in natural light, if you can get there early enough in the process to influence that sort of configuration and massing, and even if it's just another well put argument into an architect's or master planning strategy as to how this could be better if it was done in this manner, then it's a much better way of approaching it. So really important part we're talking about, and it's also a really important part that's gaining more traction and understanding. And I say understanding, I think Florence Nightingale said, back in 1858 or whenever she wrote her paper on the outcomes of British hospitals, is that military hospitals particularly, that there was three main things that she mentioned, and one was space, ventilation, and light. And she put light as the second most important factor after ventilation. And this was 150 years ago, and we've kind of forgotten about that as we've moved towards denser and we've had other things to consider, to be fair, and denser and safer environments. So lighting is always been seen, and natural light has always been seen as a really important factor, but it's kind of been compartmentalized down into the way as engineers it can be measured. And I say that as someone who is an engineer, but would also like to say they sit across the fence as a designer as well, and the aspirations there is about how do you make better use of understanding to try and I'm going to say sell, but promote the benefit of a different approach. And I had a scheme recently where we were looking at looking at overheating and the strategic ways to deliver natural light in some individual bedrooms or patient rooms, but understanding the movement and the movement of the sun and the movement of natural light through that space was quite an important part of my design consideration there, and particularly in relation to a number of the patients would have some severe challenges in relation to their disability, being able to move themselves or to move away from sunlight if sunlight was on them, and similarly or cognitive ability to be able to communicate. So real challenging problems. But we're also very keen to make sure they got a view out, and actually, so how do you deliver the view out and deliver an element of sunlight which can bring delight and joy and cheer to a space, and particularly if you're in their long-term healthcare environment, without relying on nurses to operate the blinds. So some really complex and difficult conversations with the trust as to how you can implement different shading strategies that weren't necessarily curtains, for example, or blinds, and actually what real benefits you could have by actually thinking about it a little bit deeper than necessarily would have done in the past. So it's some really positive things that can come out, and we shouldn't be afraid of some of the things that we sometimes are, like glare and sunlight and things like that.
Yeah, I mean, it sounds like you're, I don't want to say stepping on the toes of the architect, but certainly it doesn't just end with the physical lighting object, does it? It's a bit of, it's more of a holistic approach when it comes to the building fabric for something. And I guess being with Arup, you're going to be part of that discussion from the beginning because of the engineering background, etc. So that's healthy for the healthcare. It is healthy, isn't it? Let's face it, because light just doesn't come from electric light. Let's face it.
If you can get it from, let's call it a free source, and that's, it's always a good message to sell, and low carbon source if it's done the right way. The more we can make out of natural light and the healing and well-being benefits that you get from exposure to that, it needs to be the first thing we think of. And yes, I'm in a good position where I am, that I have a better chance at getting to those conversations earlier about forming the building and talking to the architect, and I'm not competing, but it's about supporting and understanding and communicating. But it's also about challenging and working with mechanical engineers and understanding the overheating and the challenges that can come from too much sunlight, or the losses and thermal gains, and balancing all those requirements. So I believe that as we move forward into, I guess, the next generation of hospitals, a holistic approach to the building design and building construction is going to be so important, and that's right down to lighting designers, whether you are able to influence the daylight and the structure there, or actually about whether you're considering how your electric lighting design needs to complement that and work with what natural light's available there to provide I guess a cost-effective but solution that is geared towards creating better environments, better healing environments. That's all we really want, is the outcome, not how we get there. The outcome is better.
Oh, absolutely. I mean, I think you touched on it actually, because I was going to ask, when you're approaching these types of projects, what would you say is the single most important element? And it's probably daylighting, isn't it, for something? And in respect to the non-visual aspects of lighting, i.e. circadian rhythms and such like, how much, what's the current evidence in use around healthcare? Have you got any information on that? And how do you apply it?
It's a really interesting question, and it's the delivery and application. And I'll talk from my own perspective, and others may have a greater visibility of this in other parts of the UK and working, but it's a really tough sell within the NHS environment as to the benefits there. But it's slowly creeping in terms of where the research is. I think there's always a nervousness around in any clinical setting how what you do may influence your patients. So being very careful not to be seen to be experimenting on your patients without sufficient evidence and backup, and what you're talking about is always a real challenge. But I think there's a growing body of evidence there about what is okay and can be done, and where the boundaries should be on any sort of changes around that. In terms of implementation, so not so much in the UK, there are defined spaces that we have introduced that sort of application, but we're very much seeing it more in the US, and in a privatized healthcare network. Actually, we're delivering circadian systems in a number of large-scale hospitals throughout the US, and I haven't seen the evidence and research back from them, but they're being embraced as something that is a good and positive effect that can have on the well-being of the patients. And it'd be really interesting to know if some of those client bases, after having installed them for 10 years, if they see faster healthcare outcomes, whether you could actually separate that out from other influences and practices. I think it'd be interesting.
I think that's one of the biggest problems, isn't it? I mean, I think you mentioned Florence Nightingale, but I think her approach was statistical, most of it, wasn't it? I mean, she based it on a statistical approach. So as with any healthcare, it really does rely on so many different elements, and to try and dissect those elements is really hard, because it could be anything. It could be change in diet, it could be exposure to good doctors or anything. But if you could extrapolate that, that would be so interesting to see for the future. And I think it probably does have a helping hand. I would hope it does anyway.
I hope it would do. And I'd be really into what I still think that we've not quite yet challenged, is that the right way to put it, is a lot of the focus tends to be on patients as opposed to staff. And while the patients are in a vulnerable position, or they may have reduced capacity on the immune system, or they're obviously not feeling very well, and well-being is generally seen as a real influence as to your speed of recovery, is how happy you are, and that is there is evidence around that. I still don't think we think about our staff, that our nurses who are sat in perpetual twilights because they're a nurse station away from any windows for most of the time, or they're working night shifts, and we're not properly thinking about their needs and how to keep their levels of alertness up without experimenting on them or shifting their rhythms and things like that. I think that's one of the areas I think I'd like to think there was some real advantages that we could bring to about their well-being and their feeling, but having a clear strategy for doing that and measuring it and delivering it, and not burning people out would be a requirement, I think.
Yeah, it's a tricky balance, isn't it? And let's face it, I've got so much respect for nurses. It's unbelievable how much work they do, and there's so much. They're the unsung heroes often. When you see, I hate to say it, but when you see pop stars or popular culture paraded in front of people as being something special, and you compare it to what our healthcare people do, there's just no comparison, is there? It's just no comparison. And yet we don't treat them that way, or with any sort of I don't know, reverence that we do for other people in society who kick a football.
Well, it's a tricky balance, and particularly, it's the nurse, and I guess it's the technicians that we pop into basement, workshops, and all the big bits of kit that are in big concrete bunkers and things like that. And some of these staff are there for hours, and you can't help but think that they could do with a bit more help sometimes, I think. And but it's I think there's some real advantages there, I think, to rethinking that, and it works with flipping back to patients. It works with patients as well. If we think about that sort of whole experience and journey from car park to inpatient room or outpatient checkout, or examination space, I think the more than we can think about how we make that whole space more inviting and more welcoming, it would also assist in both levels, in sort of enjoyment and enthusiasm to be at work, shall we say, if we're talking about staff, but also about ease and how relaxed patients are moving through a space and getting where they need to be. Because if we talk about NHS as a machine, we just need all the cogs to be working as well as possible, and if we can get as many people to as smoothly as possible to where they need to be as quickly as they can, then everything will run smoothly, and it'll all be cheaper to run and operate, and everyone's happier and less stressed. And let's aim for utopia and say that lighting can deliver all these things. Maybe not, but we'll see.
Dan, I think I should stop you there, because that's a perfect way to end, actually. I mean, that utopian vision of our NHS is a positive note, which I think we can all agree with. So thanks to you all for tuning in, and be sure to share and like what you've seen. Gently nudge or prod that subscribe button, and see you all next series. Thanks very much, Dan.
Thank you very much.